When the Regional Homeland Security Coordinating Committee was starting to expand and include more disciplines, such as healthcare, Dr. Norman's name came up a lot.
One of the things that I think is important about the RSHCC is that people have to come with a strong level of expertise and experience in their own discipline, and they bring that to our table.
You know, Dr. Norman has been doing this a long time, and he's a fabulous physician, and he always seems to be the face that you want to go to if you have questions about health care.
But what really made Lee successful for us was the way that he looked beyond just his own set of expertise and looked at what was really happening in our region and how we could begin addressing a very critical need that wasn't met. And that had to do with the threat of infectious diseases on a regional basis.
Think back to 2014. Every day there were new headlines about Ebola in Africa. Thousands of people were dying daily, and we were really scared when we started to hear of cases being confirmed in the United States.
It was indeed a different time, even though it was only back in 2014, which isn't that long ago. We have to remember that there was hysteria, globally and regionally, locally. At a time of emergency is not the time to exchange business cards for the very first time. You want to have drilled this, and you want to have practiced it, you want to have met everybody that was going to be a player in this whole thing. And I think the Kansas City metro area was much calmer and much better informed than many areas of the country. And the reason was because we saw this, we anticipated it, and we practiced. And when it came here then as a threat, then we were ready.
And Dr. Norman has really facilitated the conversation between the states to help us get that Ebola, highly infectious diseases contract together. KU is designated as an assessment hospital, and the hospital in Missouri is Barnes Jewish Hospital in St. Louis. That would mean that people from this side of the state would have to go all the way over to St. Louis to be able to receive care for their highly infectious diseases in an assessment hospital.
It's so obvious that biological threats don't stay on one side of the state line or another. Obviously, it's a regional, national, global kind of consideration. When we met together at MARC with the Regional Homeland Security Coordinating Committee, then we looked at each other and said, we really need to cooperate. We had all the people in the right room at the same time talking about the same issue, and it was a matter of saying, let's get real. We know we're going to get patients from both sides of the state line. Let's hammer it out now. In time of peace, prepare for war. And that's what we were doing.
So to have a person like Dr. Norman lead a charge, champion a cause, I should say, and present a vision before the Kansas and the Missouri proper authorities to say, we can do this. And fortunately, he was immensely successful.
And especially in the healthcare realm, Dr. Norman has brought a lot of expertise. He's brought a lot of passion for what it is that we do in the preparedness portion of healthcare. It's not something that people think about a lot, but we have a lot that we need to do to be prepared for the next highly infectious disease or the next tornado that hits. Whatever it is, healthcare needs to be there and ready to go, and his contributions have been enormous.
There are diseases, infectious diseases that are out there that plague all of our lives. And whether you're from Wyandotte County or Jackson County, it's good to know that there is an institution such as KU, people like Dr. Norman that are here that have the expertise that can remedy and can speak to some of those issues that plague us on a far broader scale than what we would imagine. So we're glad to have them here in our neck of the woods to be a partner.
I guess the one thing that I would say that we still need to do better as the healthcare community, the emergency preparedness, is that we need to practice and practice some more. But we have to cross state lines, cross counties, cross disciplines even, cross jurisdictions, and continue to practice. We have an agreement in place and we practice. Time will tell whether we're practicing the right way to meet the next infectious disease threat. I think we are, but we can't rest on our laurels. We have to keep pushing it.